I'm Scott Simi, Chief Content Editor with Indro Robotics, and on today's edition of our SoundByte micro podcast, I'm joined by Dr. Sheldon Cheskes, Medical Director with the Sunnybrook Centre for Prehospital Medicine and a professor at the Division of Emergency Medicine at the University of Toronto. Welcome, Dr. Cheskes.
Thanks, Scott, for having me. Really a pleasure to be here.
Great. So, first off, tell me a bit about what those titles mean. What do you do?
My area of research is really I'm a resuscitation scientist. So I've spent the last 35 years or so doing research into improving outcomes for patients who sustain out of hospital cardiac arrest. That's how this whole idea of using drones came to fruition through my interest in improving outcomes from cardiac arrest. And the oversight in terms of the medical director at Sunnybrook Centre for Prehospital Medicine is my role as medical director for the regions of Halton and Peel. So those are the EMS services that I work with in most of my resuscitation trials, and they've been amazing services to work with over, as I said, the last 35 years or so. That's my background. That's how I got involved in this area of research.
So, we're going to obviously be talking about drones delivering automated external defibrillators. Let's start by just explaining why getting an AED to someone who's had a cardiac arrest as quickly as possible is really, really critical.
Yeah, really, survival from cardiac arrest is really a time-dependent medical emergency. So survival drops by anywhere from 8 to 12% for every minute someone's in cardiac arrest. So clearly, as time goes on, your likelihood of survival significantly drops off. The earlier we can get bystanders to apply AED, even far before EMS arrives, we really improve chances of survival. So the math is certainly such that early is better, and anything we do in resuscitation that is early makes a difference.
Now, I understand this research actually began in the pre-COVID days, and in fact, I actually witnessed some trials. How did this research come about in the first place?
Well, first we partnered with our colleagues in engineering at University of Toronto. So Tim Chan, a good colleague of mine, did a lot of work on geospatial mapping, sort of looking at where cardiac arrests were occurring in the areas that we were responding to calls in, and basically saying, hey, listen, we've got this sort of cluster of areas where we think drones could actually get to these areas of historical cardiac arrest much quicker than the standard EMS responses. By doing that sort of work, we were able to then do sort of feasibility flights where we tested drones leaving from point A and a EMS car leaving from point A for simulated cardiac arrest, and found some pretty big differences in response times using a drone to deliver the AED in these rural communities. We did it in Caledon, we did it in Bolton, and we were able to demonstrate that these flights could get to areas quicker than a standard EMS response could be able to do. There is basically, you're going by essentially straight line of flight for most of these calls, and you don't have lights, you don't have traffic. So drones certainly seem like they were an excellent solution for these particular calls.
So let's say a drone lands with an AED on board near a victim, and there are bystanders who've never used an AED in their lives. How are they instructed to properly use the device?
There's still this mystery for the public on using AEDs. And AEDs are some of the most simplest devices to use. But to simplify it even further, we put a FaceTime app into our AED mobile package so that once we drop the actual medical package and the individual who's a bystander opens up the package, they will not only find an AED, but they'll have a phone with a FaceTime app and communicate directly with our dispatcher of our drone who will guide them through the application of an AED. When we tested this with lay bystanders, they loved it. They felt like someone else was there with them to guide them through this. And this was beyond the 911 dispatcher helping them out. So giving this extra layer of security seemed to make a huge difference when we tested in some of our research previously.
Now, there was a pause during COVID, but I understand this research is getting back underway. What are the next steps?
Yeah, so during the COVID years, there wasn't really a pause. We had done a number of feasibility studies. We had fly during the night. We had flown in cold conditions. We had flown in a number of different scenarios, and eventually, we seemed to run up against a bit of a wall with Transport and Nav Canada. In terms of allowing us to do this for real 911 emergencies. About 18 months ago, a case was published in Sweden where a patient was saved through the use of an AED delivered drone. And that really got us all rankled because we felt we were far ahead of the Swedes when we actually started this process. So I met with the folks from Transport Canada, and they really, in January, identified some changes were taking place in November of this year with respect to the ability to fly to these particular emergencies we're looking at. And they gave us a really nice path by which we could go down to get an SFOC to fly during these circumstances. So we just learned last week that an SFOC will be granted as we add a parachute to the drone that we have purchased, and we will hopefully be able to fly within the next month to true, real 911 calls, which has always been our aim, and we'll likely be the first in North America to actually do this for these extended visual line of sight flights to try to improve outcomes, particularly for those in rural and remote communities.
And what's the relationship with Indro Robotics in this project, and who are the other partners?
So Indro Robotics was the original people that we had worked with in terms of some of our test flights that we had done. I had actually also worked with Drone Delivery Canada, who's not around anymore. They're Volatus, I think, right now, but we had done some original flights with them as well. Indro also helped Paul Snoblin, my chief in terms of community responder programs, in terms of the SFOC process, so they were helpful there. But we have plenty of partners. We have engineers, we have researchers, we have students, we have Base Hospital. We will hopefully, when we plan our further future research, work with the Ministry of Health, the dispatchers. All those people will be critical to make our process a success. So, like I said, we're really thrilled to actually be able to do this now, where many years ago it looked quite bleak, to be totally frank.
What do you ultimately envision or hope that this research will lead to?
What I think hopefully it'll research will lead to will be the implementation of drone solutions for patients with time-sensitive emergencies. So our kit not only contains an AED for cardiac arrest, but we also placed in our kit an EpiPen for anaphylaxis, naloxone for opioid overdoses, a tourniquet for stop the bleeding in patients who sustain traumatic injuries. If we can show that our work is not only feasible but can save lives, we can expand this to multiple areas across Canada, because remember, Canada is mainly rural. There are many places where EMS agencies just cannot get to in a time-sensitive emergency to make a difference, and therefore the expansion of drones for these types of emergencies could be a transformative step in improving outcomes for multiple emergencies, not just cardiac arrest.
Getting a drone loaded and launched, and checked out also takes time. Do you envision some sort of auto dispatch system down the road?
I think this whole process will become much more automated. I've seen huge changes since we've started in the automation of drone dispatch, and I only see further changes coming in the future. I think the technology is superb and will only get better over time.
In an ideal world, when would you hope such a system might be in place, even if it's on just a limited scale?
We have the drone. We have the dispatch. We have the process in place. Now it's just a matter of flying. So hopefully within the next 4 to 6 weeks, you'll see the first drones flying in Peel region.
Anything else you'd like to add?
No, no, I just really thank Indro Robotics. Thank Phil Reese so much for all the guidance he's given us in this process. He's been absolutely great. And really, this can't happen without Transport Canada. So, a real kudos to them for believing in us. And finally, Paul Snoblin, as I mentioned earlier, the heart and soul of our program. He has done so much work to allow us to get this SFOC. Hopefully, we'll be successful. And then hopefully moving forward to working with NAV Canada in a different type of airspace. The future, I think, is bright. We just need to be able to get this off the ground and show that this is something that can be done and actually save lives. So, yeah, we're really stoked. And I thank you so much, Scott, for the opportunity to speak on your show today.
Awesome. It's fascinating research and potentially life-saving. Dr. Sheldon Cheskes, thanks so much for joining us on this edition of SoundByte.
Thanks so much, Scott. Stay safe.